Hello everyone. In this video, we are going to talk about the subclavian artery and that is branches of the subclavian artery, and also we are going to talk about the axillary artery, about its relations, and because branches have already been discussed earlier, so we are going to talk about its relation, about the first part, second part, and the third part, and about its and from means and where it extends. Okay, so now let us start with the subclavian artery and its branches. Okay, so we'll talk about subclavian artery. ठीक है, तो subclavian artery, it arises from arch of aorta. ठीक है, and that is arch of aorta gives its branch, that is brachiocephalic trunk. ठीक है, so not arises, actually arch of aorta, from the arch of aorta arises the brachiocephalic trunk, and from the brachiocephalic trunk arises the subclavian artery. Okay, now let us discuss about its three parts. ठीक है, so this subclavian artery is divided into three parts. ठीक है, subclavian artery, this subclavian artery is divided into three parts by a muscle known as scalenius anterior. Okay, by scalenius anterior muscle. Okay, so what are the three parts of the subclavian artery? So these are, we'll discuss it here. Okay, so these are here, let us study. Okay, this is the first part, this is the second part, and this is the third part where we are going to study about its branches. Okay, so from the first part arises vertebral artery. Okay, internal thoracic artery, okay, and thyrocervical trunk. Okay, thyrocervical trunk. Okay, and from the second part it gives the costoclavicular branch, ठीक है, and third part gives the dorsoscapular branch. Okay, third part gives dorsal scapular branch. So 1, 2 and 3. So what is the trick? The trick or mnemonic to learn it is vitamin CD. Okay, so vitamin CD, let's learn it like this. What is vitamin CD? Okay, vitamin CD. So from the first part arises the vertebral artery, V for vertebral artery, I for internal thoracic artery, and T for thyrocervical trunk, C is for costoclavicular branch, and D is for dorsoscapular branch, which is from the third part. Second part has first part. Okay, so let us learn this. This is from the first part, that is vitamin first part. This is from second part, and this is from third part. Okay, so from the first part is vertebral artery, internal thoracic artery, and thyrocervical trunk. From the second part it is costoclavicular branch, and the third part it is dorsoscapular branch. Okay, arises the dorsoscapular branch. Now let us talk about the axillary artery. Okay, what we are going to talk about in the axillary artery, because branches have already been discussed in the previous lecture, so we are going to talk about its relations. Okay, in this video. So now let us study about the relations of the axillary artery. Okay, axillary artery. Okay, so axillary artery कैसे बनती है? ठीक है, ये जो ब्रेकियोसेफेलिक आर्टरी है ये सबक्लेवियन आर्टरी देती है, और सबक्लेवियन आर्टरी से एक्सिलरी आर्टरी, और फिर एक्सिलरी आर्टरी से ब्रेकियल आर्टरी. ठीक है, असल में क्या है कि ये जो सबक्लेवियन आर्टरी है ये एक्सिलरी आर्टरी देती है, और एक्सिलरी आर्टरी आगे जाकर के ब्रेकियल आर्टरी बन जाती है. ठीक है, तो वो एक ही आर्टरी है, एक्सिलरी आर्टरी का कोई ब्रांच नहीं है, ब्रेकियल आर्टरी. ठीक है, तो बात करते हैं ये जो सेफेलिक आर्टरी है, इससे निकली सबक्लेवियन आर्टरी, सबक्लेवियन आर्टरी, ओके। और इस सबक्लेवियन आर्टरी से निकली एक्सिलरी आर्टरी, सबक्लेवियन आर्टरी से एक्सिलरी आर्टरी, और इस एक्सिलरी आर्टरी से हमारा ब्रेकियल आर्टरी, ओके। एक्सिलरी आर्टरी आगे जाकर के एक्सटेंड्स टू ब्रेकियल आर्टरी, ओके। तो एक्सटेंट ऑफ द एक्सिलरी आर्टरी क्या है? एक्सटेंट ऑफ एक्सिलरी आर्टरी, ठीक है। एक्सटेंट ऑफ एक्सिलरी आर्टरी क्या है? आउटर बॉर्डर ऑफ फर्स्ट रिब, ओके, टू द लोअर बॉर्डर ऑफ टेरिस मेजर मसल, lower border of teres major muscle, okay. Now let us talk about its first part, okay. Now we will talk about the first part, relations of the first part. Relations of first part of axillary artery, okay. Relations of first part of axillary artery. So anteriorly it is bounded by, anteriorly there are skin, okay, superficial fascia, okay, platysma muscle, deep fascia, and the pectoralis major. Platysma muscle, deep fascia, and pectoralis major muscle, okay. Then posteriorly lies the serratus anterior muscle, ठीक है, along with medial arch of brachial plexus, okay, with medial arch of sorry, not medial arch, it is medial cord of brachial plexus, okay. Medial cord of brachial plexus. Laterally it is lateral and posterior cord of brachial plexus, lateral and posterior cord of brachial plexus, ठीक है. And medially it is axillary vein, medially it is axillary vein. Now we are going to study about the second part of axillary artery, okay. So now for the second part, okay, so for the second part, anteriorly it is bound by skin, superficial fascia, pectoralis minor, and the major muscle. Skin, superficial fascia, pectoralis minor, and pectoralis major muscle, okay. Posteriorly it lies posterior to it lies the subscapular muscle and the posterior cord of brachial plexus. Subscapular muscle and posterior cord of brachial plexus, okay. Then comes the laterally, okay, lies the coracobrachialis, short head of biceps, and lateral cord of brachial plexus, okay. Coracobrachialis, short head of biceps, and lateral cord of brachial plexus, okay. Brachial plexus. And medially lies the medial cord of brachial plexus and the axillary vein. Medial cord of brachial plexus and the axillary vein. Okay, now let us talk about the third part. Okay, so now let us talk about the third part and its relations. Okay, so anteriorly it is bound by the skin superficial fascia and deep fascia. Skin superficial fascia and deep fascia. Okay, posteriorly it is bound by subscapular muscle. Okay, axillary nerve and radial nerve. Axillary and radial nerve. Again, upper part of serratus anterior muscle. ठीक है, upper part of serratus anterior muscle. ठीक है, laterally by the coracobrachialis. Laterally by coracobrachialis and musculocutaneous nerve. Coracobrachialis and musculocutaneous nerve. Okay, and medially by the axillary vein. Let's make it in a good way. Axillary vein. Okay, medial cutaneous nerve of arm and forearm. Medial cutaneous nerve of arm and forearm. Okay, and the ulnar nerve. Okay, so here our video is complete.